we have a beautiful young patient here. She's 39 years old. And we're going to talk about who is a good candidate for under eye filler and why, because that's a hot topic. So, I'm going to have you not smile and just look straight ahead, okay? So you can look at me or, you can kind of look in the distance. Let's do that. Let's do straight ahead in the distance.
Okay.
So when she's at rest, you see a little bit of this hollow here and this hollow here. Look up for me for a sec. When she looks up, it's accentuated. She has a little tiny bag here and a little tiny bag here, but they're very small, and when you look up, they get worse. So now look straight, not down, but kind of straight in the distance. Yep, perfect. So she is a good candidate for under eye filler because she has excellent skin. It's taut, there's not a lot of laxity. So we know that this is gonna hold the filler well. She does not have a bag when she's looking straight, even though it's accentuated when she's looking up, but it's mostly the hollow. So by filling the hollow, and this is how you check, you push this tissue underneath up just a little bit. You can do it with a Q-tip, you can do it with a finger. So I'm pushing this up to see if by filling this little hollow, it looks better, and it does, because all we're trying to do is connect this to this. We want to have a smooth transition from the eyelid to the cheek junction without the hollow. I'm going to turn you slightly this way. Same thing on this side. There's that indentation here that gives her a dark circle. By pushing this up, you can see how it takes away the indentation. Nothing is bulging. It's just a smooth transition from her eyelid onto her inner cheek area. So I know that by putting filler in here and then in here, we can create a nice smoothness, nice contour that will get rid of the dark circles. The filler is going to go deep under the skin and under the muscle on the bone so that everything above it is holding it nice and taut. And it's going to be beautiful. It's going to look great. What the filler is not going to help with are the wrinkles. We're doing Botox, we're doing some skin tightening procedures, so we are not using filler to correct under eye wrinkles. It doesn't work, and it can actually make things worse. We're only doing it to fill in the hollows, okay? Now, if Megan had big bags, so look up for me, like if this was really, really puffy, like that, you see how when I do that, it puffs out? If she had this, you see how when I pull this up, yeah, it fills this in, but the bag is still there. So if she had this, a filler would not be a good treatment. Then we would be going to surgery to get rid of the bag and use her own fat to fill this in. Same thing here, guys, look. You see, if I do this, that little puff comes forward. So then, if I do this, it's just all kind of puffy. Not a good situation. So then we would not be doing filler. So if you have a bag, if you have a little pouch there, a muffin top, then you would not be a good candidate for under eye filler. I hope that clarifies things and you kind of get a gauge of what would work best for you.
Thank you.